What's really happening with healthcare data breaches? The common story is that sophisticated hackers are using cutting edge AI to penetrate systems. The reality, it's usually just nobody watching. This week, Texas Attorney General Ken Paxton launched an investigation into what he called potentially the largest breach in U.S. history. 25 million Americans were affected. And when you dig into the details, this isn't a story about technology failing. It's a story about humans failing to oversee other humans. In this video, I'm going to break down what actually happened and, more importantly, what it means to anyone running a business with health benefits. First, how a simple printing company exposed 25 million Americans while no one noticed for 3 months. Second, the vendor accountability problem that's hiding in every employer benefit stack. And third, why self-funded employers, even small ones, are on the hook for breaches they didn't cause and they really can't control. Here's why this matters right now. If you're an employer offering health benefits, you probably have vendors you've never heard of touching your employees' most sensitive data. And when things go wrong, you're the one holding the bag. Let's dive in. The common story with data breaches is sophisticated nation-state hackers like China or advanced persistent data threats. But the Conduit breach tells a different story. Conduit is a business process services company. They do back office work for healthcare organizations across 46 states. They process 500 million Medicaid claims annually and handle $85 billion in public benefits. For health insurers, they handle something pretty mundane and boring: printing and mailing explanation of benefits. Those EOBs that show up in your mailbox, someone has to print and mail them. Here's what happened. Between October 21st, 2024 and January 13, 2025, the SafePay ransomware group had persistent access to Conduit's work. 3 months. They were inside the system for 3 months, and they exfiltrated, or downloaded, 85 terabytes of data. That's a lot. That's not a smash and grab job. That's moving in and redecorating the house. The breach wasn't discovered through sophisticated threat detection. It was actually discovered because the attack caused operational disruptions. The hackers essentially got caught because they broke something loud enough for someone to actually notice. Think about what was in those EOB files. We're talking names, dates of birth, social security numbers, diagnosis codes, treatment information, provider names, claim amounts, every piece of data you'd need for medical identity theft, all sitting in a printing company system. And here's the part that jumped out to me. The health insurer learned about the breach in January of 2025. Employer groups, the companies whose employees were affected, didn't get notified until October of 2025. That's 9 months later. The key insight here is that this wasn't a failure of technology. The security tools, they've existed for decades. The monitoring capabilities, they exist too. This was a failure of human oversight. Someone, actually probably lots of someone, should have been watching, and they weren't. The common story here is that if you hire a reputable vendor and you sign a business associate agreement, you're protected. That's what HIPAA requires, right? You get the BAA signed, you check the box, and you actually move on. But here's what's actually happens. You hire a health insurer, they hire a claims administrator, the administrator hires a printing company, the company gets breached, and now your employees' data is on the dark web. The problem is that oversight typically stops at the first layer. Most employers have never audited their health plans vendors, and most health plans have never continuously monitored their subcontractor security posture. The business associate agreement exists, but the ongoing human oversight, that's where things fall apart. In 2024, 41% of third-party breaches impacted healthcare organizations. The vendor breach rate in healthcare surged 400% in just 2 years. And healthcare data breaches cost an average of $9.42 million per incident, the highest of any industry that we measure. Consider the Volvo Group disclosure that came out last month. Nearly 17,000 Volvo employees had their data exposed in the Conduit breach. But here's the thing. Volvo probably never heard of Conduit. They hired a benefits administrator. That administrator used Conduit for some back office functions. And now Volvo's HR team is explaining to their employees why their medical information is compromised because of a vendor 3 layers removed from any contract that they signed. This is happening to employers everywhere. Right now, there are self-funded employer plans across the country that don't even know yet that their employees were affected. The notification process is still ongoing. Conduit expects to finish notifying people in April of 2026, a year and a half after the breach started. The part most people miss, business associate agreements are legal documents. They establish liability. What they don't do is prevent breaches. That requires actual humans reviewing actual security practices on an ongoing basis. And in most vendor relationships, that ongoing oversight simply just doesn't exist. The common story is that if a vendor causes a breach, the vendor is responsible. They pay the fines, they send the notifications, they deal with the lawsuits. That's not how it works, especially for self funded employers. When you're self funded, you're the plan sponsor. You're the one legally responsible for your employees' protected health information. Yes, you can contractually require vendors to indemnify you. Yes, you can require them to carry cyber insurance. But here's the thing, you cannot contract away your regulatory liability. State attorneys generals will investigate you. The FTC can come after you. Class action lawyers will name you in lawsuits. And you'll be left to claw back the costs from vendors through indemnification clauses, which only work if the vendor is still solvent and their insurance covers your exposure. In the Conduit situation, Conduit has reported $25 million in direct breach response costs. That's just their internal costs. It doesn't include what health plans and employers are spending on their own response, legal fees, and credit monitoring for affected individuals. There are now multiple class action lawsuits consolidated in New Jersey federal court. A federal judge appointed an 8-member plaintiff steering committee in December, and the Texas Attorney General investigation is just getting started. They've issued civil investigative demands to both Conduit and the health insurer. Think of those as subpoenas. Here's what that means for employers. Even if you weren't negligent, even if you did everything right on paper, you're still potentially exposed. Because when regulators and plaintiffs' attorneys start looking for deep pockets, they follow the money. If you only take away one thing from this, your vendor security is your security, not because of some abstract principle, but because the legal and regulatory framework treats it that way. The liability flows downstream, and the last entity standing is often the employer. So let me pull this all together. We've covered 3 things. First, the Conduit breach wasn't a technology failure, it was an oversight failure. 3 months of undetected access because nobody was watching. Then the vendor accountability gap, most organizations don't continuously monitor their vendor security, and breaches cascade through these blind spots. And third, employers bear downstream liability even for those vendor failures they didn't cause. For anyone running a business with health benefits, the opportunity here is to actually implement continuous vendor oversight, not just collect BAAs and then file them away. Audit your vendors, ask who they subcontract with, require evidence of security practices and not just attestations. The risk of waiting, you find out about your exposure the same way 25 million Americans did, when the notification letter arrives a year after the breach happened. If this was helpful, subscribe for more on the practical side of healthcare technology and running a business. And if you want a deeper dive on this, including the full timeline and what to watch out in this investigation as it unfolds, I've got a full write-up on my Substack, links in the description. Thanks for watching. I'll see you in the next one.